Hello, everyone. Welcome to another edition of Ask Me Anything. We are joined here today by Stacey Mitchell and Rose Luna. If you're here today, you're joining us for the AMA. Our clinics offer follow-up care through telehealth for survivors. Just a reminder, folks, we want to hear from you, our members, what questions you may have from the field. So you can post them in the comments. We'll be able to populate them through. But just a reminder, we want to hear from you. So we're going to go ahead and get started. Y'all ready?
Mm-hmm.
All
Yes.
right, jumping right in. What is the Assessment for Care in Trauma Survivors Clinic, also known as ACTS?
All right. Good morning, everyone. And thank you, Courtney. Thank you, Rose, for inviting me to be a part of Ask Me Anything. To start off, the Assessment and Care for Care in Trauma Survivors Clinic, our ACTS clinic, is a follow-up clinic that is virtual or is through telehealth modalities for survivors of sexual assault and sexual violence. And we wanted to make this available so that any survivor in the state can have access to follow-up medical care and also follow-up mental health services as well. So we're really excited about this clinic because it's telehealth. If you are not, if we have a survivor who is not comfortable going back to their primary care doctor, then they can see an advanced practice nurse who has specialized training in trauma-informed communication, trauma-informed care. One of our APRMs is a SANE and has practiced as a SANE for many years. The other, we have two. The other has worked with sexual assault survivors and in providing post-sexual assault follow-up care for their health. And we brought these two together. We're really excited because this clinic just increases access to services that so many survivors of sexual violence need.
Awesome. And that hasn't been around that long, has it?
No, we went live in July. And so yeah, it's like 3 months. We were counting it up yesterday and we were like, 1, 2, 3. But it's pretty exciting. Yes.
Yes. And then what is the goal of the ACTS clinic?
Well, I think the major goal for this clinic is to increase access to service. We know that many survivors of sexual violence do not follow up. Do not go see a provider for follow-up healthcare. And we want to try and make this as easy as possible to encourage survivors to seek additional healthcare because they do need additional healthcare. They need to make sure that any injuries are healing, that they have appropriate referrals for mental health services and counseling. And if there's additional lab testing that needs to be done, then we can make those referrals and send them to a lab to have, additional blood drawn or urine tests done or, x-rays done. I mean, we just want to make sure that we have access to care for this population, for our survivors of sexual assault here in Texas.
Nice. So we talked about the importance of it to survivors, but we do want to also know, why do you feel this is an important resource for advocates?
Well, I think, the partnership between healthcare and advocacy is so strong. As a forensic nurse, I rely so much on the advocate in the room who can be there for that patient and support them. And having the ACTS clinic as a resource is just one more tool in the advocate's toolbox, is to say, hey, we could refer you over, to this. If you haven't followed up for healthcare, then here's another option for you to consider.
Nice. And Rose, what are your thoughts on that as well?
Yeah, when I first heard of this, it was funny. We were at a task force meeting at actually DPS, and Stacey just kind of flippantly mentioned it and was passing these things. I was like, oh my God, what a great resource, because it took me back to the days when I was a hospital advocate. And I do remember being there in the room. And after accompanying survivors a few times, I even created my own list of things that, not to say that the program that I was volunteering for didn't have that. It was just things that I was seeing that I knew I needed to know on hand right away. I created my own list. But yeah, so this is very helpful in that regard. Also, I remember having so many conversations with survivors who didn't want to come back. Why? Because they didn't want to be on their parents' insurance. Oftentimes they're still on their parents' insurance, and this is just something that they're not ready yet to disclose to anyone. Or they didn't want to come back to this place where they were seen and had, forensics done, and it might trigger some memories. And also, at the end of the day, a lot of the times, y'all, when survivors would come, the ones that this is again speaking anecdotally, just from my experience with survivors in the emergency room, oftentimes they just want to make sure that they're okay, that their body's okay, that they're have access to these prophylactics or whatever it is that's needed. Oftentimes they don't have that verbiage. So having the forensic exam done, which is separate and apart from their medical exam, is so helpful. And having an advocate there to kind of decipher between the two, but also then when they're done, because they're not going to remember everything, but having the advocate as a partnership to the forensics to be able to say, here's this resource. I know you were worried about follow-up care. You didn't necessarily want to go back to that place, and you don't want to go over here where your parents might. Here's this other option for you, and it's so easy for them to be able to get that. Again, all the things that Stacey mentioned. So that's one reason I think it's so important for us as advocates, not only to have our survivor guide and to have. There is a resource, the survivor rights resource from the governor's office. But also the third thing that I would recommend that advocates carry with them to turn over to the survivors once this is all said and done, and also follow up. Sorry, that was long.
No, that was great. Thank you both for your response on that. So, follow up to that, what all do you currently offer for advocates to provide for survivors?
Well, we have developed little cards that can actually be, put in the little in the packets that either they can receive from the hospital or either from the advocate. And it has all the information about the clinic on it. It has obviously the clinic. It has what services we provide. And then there is a way that patients can actually request an appointment. They can either make an appointment themselves by scanning like the QR code on their telephone, or they can actually call us if we have some patients, some folks are like, yeah, no, I can't do that. But they can always call us and we can make the appointment for them and have that set up for them and we'll send out reminders as to, yes, it's time for your appointment. Don't forget to log in, and there'll be instructions on how to log in and to access. And you can have the appointment on your cell phone. It could be on a tablet, or it can actually be on a computer, just like, how we are here today.
Nice. And just so y'all know, you'll receive an email that includes a link to that attachment. All right. Mm-hmm. So why should centers consider referring out to the ACTS clinic for counseling?
That is a great question. I know many centers have counseling services available, but we know that in our state, mental health services, there's a huge gap, and there's just not enough mental health providers to provide services to just the general population, much less who have a trauma background and who understand the trauma of sexual assault and how to provide services to this population. And we also know that some of the clinics, you have a waiting list. And, and we want to have that and be an alternative, that if you have a waiting list, here is another option. So your survivor can say, I think I want to stay here on the waiting list, or no, maybe I'll try this over here and I'll talk to this counselor. We have partnered with the Texas A&M Telebehavioral Health Institute, which they have hired a trauma counselor who is dedicated to us. We have specific appointment slots just for our clinic. And they are excited to be providing services for us and to help survivors of sexual assault and to be that alternative, for long waiting lists.
That's great. Mm-hmm. So y'all, we're going to take a moment. I just want to remind you again, we want to hear from you, our members, what questions you may have from the field. So please go ahead and post them in the comments. We will circle back to them in a moment. And while we wait for your questions, I have a unrelated question for y'all. So, this summer has been really, really, really hot. So I'm wondering, now that we're into some cooler degrees, what are y'all looking forward to now that it's under 100 degrees outside? And I'll give you a moment to think about it. Mine is I look forward to making soups, stews, and chilies. Honestly, I eat it all year round, but now I have an excuse of like it's cold, so I get all the hot things.
Oh, that is a great excuse. I love that. I think I'm looking forward to just being outside without having to run from the air conditioned car to the air conditioned building, and being able to just be able to walk around without, even becoming drenched in sweat. Just being able to spend a bit more time outside and get some exercise. That's kind of what I'm looking forward to.
Nice. Rose, how about you?
I like the excuse. Yes. I mean, any excuse for me to try to bake. I mean, I say it every year. I tell my daughter, oh my God, when fall comes, we're going to try all these recipes and bake. So I'm going to say that one more time. I don't know if I'll actually do it, but I am looking forward to that, or just the idea of the baking that happens. But also I'm looking forward to the football. Like I love football, college football, A&M, of course. Graduate from A&M.
That's right.
And so, it's just football weather. It's football weather. It's baking weather. And then, also another thing I can probably lie to myself about is like, I'm going to go jog. I always say, this is jogging weather. I don't jog, but maybe one day I'll start that. So those are all the things that I'm going to tell myself that might try to do. And then I'm also looking forward to do.
Nice.
Yeah.
I love both of those responses, y'all. Thank you.
I love the baking. It's like, yes.
I mean, I would love to claim that I would bake, but I'm probably still not going to bake.
I can follow directions really well. That's baking. Cooking is a little different. You got to have finesse. Yeah. I'm like, I don't know about that, but I can follow directions really well.
I don't see any questions in here. Hello, I see we got someone watching from Deaf Smith County Crisis Center.
Oh my gosh, Deaf Smith! Yay!
Right.
So we'll go ahead and continue on. And I just wanted to circle back. Was there anything that I did not give you a chance to answer? Y'all feel good, right? All right.
Can I add on to Stacey's amazing answer to the last one about why we should be referring out for the counseling? Can I add to that?
Yes, please.
So as Stacey said, absolutely. I think, as an advocate, options are so important to me, or, as an advocate, I want to be able to provide options. And I think there's nothing worse than, talking to a survivor and them mustering up finally and calling a rape crisis center to say, I need help. And then for them to be met with, oh, okay, we can talk to you in 3 months or 6 months. I think there's nothing worse than that. So I think that it's really helpful for us now to have an alternative, an option to say, we can put you on our wait list, but also you can call this number, or you can, do a Zoom with this number, with these folks, and explain how they're trauma informed, because that's the other thing, I know with across the state is our programs are having trouble, as Stacey mentioned earlier. First of all, mental health as a whole, we have an issue with, here, but also trying to find someone with that mental health background, counseling background, that has that understands trauma to that level, and two, understands the intersection of that trauma with sexual assault is a whole other level of expertise that is super hard to find. And the fact that we have that with our rape crisis centers, and now another option through A&M, I think is just a wonderful, wonderful thing for survivors of sexual abuse here in Texas.
Thank you, Rose. Before we continue, because I did do a shout out to Deaf Smith County that's watching. Thank you, Laura, from watching from the Brazoria County Sheriff's Office Crime Victims.
Woohoo!
So we're going to go ahead and wrap up unless y'all have questions. So a few more questions. How do survivors make an appointment?
Oh, yeah, that's a great question, because it's like, okay, we've got a service now. How do we access it? With the ACTS clinic being here at A&M, Texas A&M, in the Center of Excellence in Forensic Nursing, we have, a great infrastructure, and we've got a couple of ways that patients can make appointments. They can actually call us if they would like, and we have a trained administrative person who works for the clinic, and they can make the appointment directly for them at their convenience. We even are looking at some evening hours, so that survivors who have to work, then they could actually have an appointment after hours and not have to take off during the day or take their lunch break to have an appointment. So we want to be flexible. We also the survivor can make an appointment themselves. They can go to the website, forensic nursing at tamu.edu, and we have a button that you can click on for the ACTS clinic, and it will take you over to the website where the survivor can make their own appointment. On the backs of the cards, we also have a QR code that will take you directly to the site to make an appointment there as well. So we wanted to try and make this as easy as possible and have several different options for accessing the site and to make an appointment.
That's great. And I like that y'all extended your hours just because you just never know when you're available to be able to do things like that. Last question, how can folks access the available resources?
I think the best way is to visit us at our website at forensicnursing.tamu.edu, and they can go directly to our website, see everything that's going on with the center, access the clinic, and learn more about the clinic. And then if there's additional questions, we have an email that anyone can email us questions, or they can call us. And we have administrative personnel that work with us that can connect you to somebody who can answer your questions.
Perfect. And then I was going to say, just to add in, for the little brochures, we also have some available, right, Rose?
Yes, we do.
Here they are.
So yeah, between TASA and A&M, you will be covered. But I think these are really helpful for us to include in our packets, whatever it is that we take to the hospital. Like I said, the survivor guide, I think the governor's office survivor rights brochure that they created, it was created for survivors by survivors from the Sexual Assault Survivor Task Force Survivor Working Group. Great group, and they created this really nice thing. And then also, I think these those three things, and we're set. Also, then the follow up. But yeah, very excited. But between A&M and TASA, we will make sure that you get what you need to make sure survivors know their options for sure.
Yeah, I mean, that's our goal, is to really find where there are gaps. So, the center wants to find where there are gaps and see how we can fill those gaps. And this was something huge that we said, follow-up care, survivors need follow-up care. And so how do we fill that? And, with some of our other programs that we have with telehealth, then we thought, well, let's just leverage that program and let's develop a telehealth clinic where anyone can access from any area of the state. You don't have to be here in Bryan College Station. You can be anywhere. Down in South Texas, you could be up near the Panhandle and still access the services through the ACTS clinic.
Stacey, I have a question for you really quick. Yes. And it might be a question that maybe other advocates might have. So I remember being at the hospital in the emergency room once with a survivor of sexual assault, and they went through their forensic exam. And so at this particular location, they were giving them, you can go here for this testing, you can go there for that medication, you can go. So it sounds like instead of saying you can go here or there, one option would be you can contact this and get some up and ask questions and get some follow-up care through this clinic, the comfort of your own home. I mean, as far as calling and asking that question, is that correct? Is that an accurate statement?
Yes, that's correct. Absolutely. And if we need additional lab work, we have contracts with different laboratories around the state, and the survivor can go there. There's, no questions about why you're here. It's, this is the labs that we're going to be doing, and the results will come back to the provider, and then the provider will set up a follow-up appointment and contact the survivor and go over everything with them. We want to make sure, and we'll see the survivors for as long as we need to in follow-up, because that's so important. It's not a one and done. We know that, medical care, we know that mental health services are not one and done, that it's, we're in it for the long haul for survivors, and we're here for everyone here in Texas who need help.
Awesome. Well, if folks have any additional questions for Dr. Stacey Mitchell about the ACTS Clinic or telehealth and supporting survivors, you can contact forensicnursing@tamu.edu. So y'all, that's the end of my questions. Double checking, I don't see any additional questions. So I just want to thank you all for joining us today for another AMA. And yeah, we'll see you next time. Bye, everyone.
All right. Bye-bye. Thank you.